I'm going to present to you our results of using PRESBYOND Laser Blended Vision in commercial and military pilots requiring Class 1 medical certification. I am a consultant for Zeiss Meditec, but I don't have any proprietary interest in PRESBYOND as such. Pilots, of course, have a very challenging time when they become presbyopic because cockpits are not designed by presbyopic engineers. They have a huge number of different distances that they have to deal with and different lighting conditions, night, rain, haze. The difficulties that we've learned over time, we used to develop a questionnaire, which then was used to gauge the drivers that brought them to having surgery in the first place. The cohort that we are going to describe is a group of 23 commercial pilots, ages 42 to 65, myopia up to -6, hyperopia up to +4.875. All of these patients were treated with the PRESBYOND Laser Blended Vision module on the MEL 80 and 90, and flaps were made with the VisuMax. The near eye intended refraction was approximately -150, slightly less or slightly more depending on pre-op testing parameters. So if we look at the monocular uncorrected distance visual acuity, we achieved 100% 20/20 and actually 57% 20/16 for the eyes that were set for distance. The near vision, 78% were 20/60 at distance in their near corrected eye. Binocular vision, which of course is the way they function, is very interesting. We had 100% 20/20, but the 20/16 rate went up to 78% from the 57% because of the binocular summation, which we have achieved with PRESBYOND, quite different from monovision. In terms of intermediate vision, J5 was achieved in 86% and J8, J10, 100% at 66 centimeters. The binocular near visual acuity, uncorrected, was excellent. J2 was achieved in 100% of the eyes, and 83% of the patients could see J1. The refractive accuracy was as one would expect for excimer lasers of this kind, so 93% within a half diopter of intended, and stability reached at the 1 month mark. The refractive cylinder, as one would expect, was corrected very efficiently with 98% of the eyes ending up within half a diopter of intended. And if we look at the average outcomes, we achieved plano in the distance eyes and about -150 as intended in the non-dominant eyes with, as I said, more than 90% of the eyes within a half diopter for both near and distance eyes. Safety, there was a 9% loss of one line, but 2 of those eyes were in a patient who was refracted up in Scotland, and we're not sure if they pushed them to 20/16 post-op. And nevertheless, the other 2 eyes lost one line from 2012 to 2016, and one of the eyes was a -3, and the other eye was a +350. The mesopic contrast sensitivity actually went up from before to after surgery, and this was seen across the board. There were only a few eyes that lost 1 or 2 patches. In terms of optical scatter index, which we measured before and after surgery, there was no change from before to after. And this is very important because cataract surgery, even with monofocal IOLs, we see an increase in ocular scatter, 1.45, and with multifocals, 2.5. All of the patients achieved the Class 1 certification requirements by the 1 month mark, so everyone was ready to go back to flight within a few weeks. The questionnaire was developed, as I said, with the pilots together. In terms of the survey results, a third of the pilots received Class 1 certification without spectacle restrictions. 2/3 still had a spectacle restriction on their license, but that's because of the uncorrected visual acuity in the non-dominant eye and that restriction. However, 3 out of the 15 pilots only were using spectacles in the cockpit, and the rest of them, 12 out of the 15, were 100% independent of glasses at all times for all tasks. These are all of the questions that we developed in this questionnaire based on the pilots' recommendations. And as you can see, the drivers for having surgery meant that most of these pilots felt adequate or poor in terms of their visual correction with glasses before surgery. And all of these raised up to good or excellent, particularly headset comfort, oxygen mask use, flight deck checklists, transitioning between the heads-up display and the flight deck, and obviously general eye comfort. They work in a very dry air environment. So in summary, pilots, when they become presbyopic, actually find their visual correction aids unsatisfactory enough to come and seek help. And what we're demonstrating here is that PRESBYOND Laser Blended Vision is safe with respect to contrast, ocular scatter, and symptoms, and it produced very high satisfaction rates in all of the categories mentioned by the pilots as being drivers to coming and seeking a different solution from glasses and contact lenses. And thank you very much.